Welcome back to Talk of the Town. There is life after breast cancer, and our next guest is living proof of that. Dr. Rebecca Baskin is a survivor, and she's also a surgeon at Williamson Medical Center's Breast Health Center. She's here today with some important information that every woman needs to hear. Great to have you with us today.
Thank you for having me, Marilyn.
And you are celebrating almost 10 years since your diagnosis of breast cancer.
Next month.
That's wonderful.
Isn't it exciting?
And you're here to tell us that there is life after breast cancer.
Absolutely. There is life, there is vibrant life, and there's excitement after breast cancer. What we want to make sure is that women, if it happens to happen to them, that they've caught it early and that they're not scared to get their screening mammograms and to see their doctor if they're having any complaints before or after that happens.
So early detection is the key.
Absolutely.
And these days, with the technology advancing every day, it's possible to really detect even the smallest of cancers.
It is. We're finding just few millimeter cancers. We're also finding stage 0 cancers called in situ, so not even invasive yet. And those are really picked up on mammogram. And so it's very important to get the mammogram along with your exam at least every year. I think it's at least a discussion to have with your physician, because most women have dense breast tissue or some family history, and therefore they're really not just any general public, so they really need to be every year.
Okay.
I think the new things that we have now, most women have had digital now, mammograms, but it's still 2D images that they're comparing to see if there's anything new and small. But the new is the 3D, or what's called tomography mammograms. And these, it's almost kind of like having an action shot of your breast. It's taken the same way. It doesn't hurt anymore. You're not even in compression for longer. And it takes multiple little pictures fast. And that computer is able to regenerate the picture into a 3D model of our breast that then the radiologist can kind of scroll through, and so they can pick up these tiny areas of distortion where the tissue just looks a little bit different, or a small mass, smaller than they can on just comparing two flat images together.
And you're also able to use 3D for biopsies as well.
Exactly. So with that 3D, there's the ability to also do needle biopsies with the 3D imaging. So if that's the only way we're able to find your small area of distortion or small nodule, now we have the ability to target that with a needle. It's actually in a sitting position, which I think a lot of women think is a lot more comfortable than the laying flat position on the tables that we have done before. And so the accuracy is so good because they're able to see exactly where they're going to target.
So when a woman goes for her annual physical, the doctor will say you need to get your mammogram, and here's where you need to go. But you don't have to go to that place that the doctor recommends.
Investigate, and definitely if you are someone who has any risk, or you know that you have dense breast tissue, and you should know because it should have been in your letter from your last mammogram if you have dense breast tissue, or your physician would know based on what is said on your last year's mammogram, then you know that you should ask for the 3D and ask at least, can I go to a facility so that that's an option for me? And that way we know we can find 40% more cancers in dense breast tissue with that 3D mammography.
And you want to go to an accredited breast center.
Absolutely. That's what I love about the center that I'm at, the accredited breast center. With that, there's a nurse navigator. Ours is Carrie Ralph. She is so educated and has been doing this for so long. She takes the women from the first abnormal imaging, or something is found in imaging that just needs second look imaging. She helps walk them through the process. And if ever even gets to biopsy, she's there and we're there for them. We try to work in as many same day and next day biopsies. Move as fast as that woman is comfortable with moving, and towards being very proactive and finding out what's going on. And so we don't want it to be scary. And even if you needed a biopsy, only 80% of, actually 80% of those are benign. So that's peace of mind when you get that call, and we make those calls as soon as we get the answer.
The survival rate is so much better these days than it used to be.
It is. The survival rate is better. Life length is better after this, and we think that it's a combination of better treatments as well as better screening. So the earlier that we're catching them, the better the outcomes are.
All right. You have a big event coming up next Friday so people can learn more.
We do, the Healthy Use. So that's next Friday from 11 to 12 at Williamson Medical Center. It's a large room, it's free, and we're trying to educate the public on this new technology, as well as just debunk some myths that are out there. I know women have questions about how much can I drink, what's safe, just all kinds of things that they want to ask questions. And they'll actually be able to ask questions of Carrie Ralph, the nurse navigator, and I, and have those answered.
It's good to know. You need to be sure to be educated and to get that early detection done.
Women want to be proactive. They want to be educated, have their information, and be able to choose for themselves. I think that's wonderful.
Thank you so much for being with us.
Thank you very much.
Good
Meryl.
information that we all need to hear. To learn more about the Breast Health Center at Williamson Medical Center, there is that Healthy You event next Friday at 11:30 to 12:30. Lunch is included. It's free, but you do need to RSVP. There's a link on our website at newschannel5.com with all the information so you can save your spot.